The portion of Pennsylvania's public welfare budget spent on older Pennsylvanians continues to grow. Much of the spending is for nursing home costs. Do you believe Pennsylvania should shift a significant part of this spending to lower cost and more consumer-friendly home and community-based care programs?
Absolutely. I worked in the SNP Home Medical, and we provided exactly the type of care you're talking about. We provided care for people in their homes so they could stay in their home, they could stay independent, and still get the care they need. It's so important that we make sure people have the tools that they need to be able to stay independent, live their own lives, and not be forced into a nursing home. So yes, I would support such a measure, absolutely. I think it's very important. And the people that I've worked with are so happy that they're able to have that option to stay in their homes. We need to make sure to keep providing that and make sure that's an option for everybody.
Mr. Gabler?
It has been a true honor to meet one-on-one with constituents these past 2 years, and one of the best experiences that I had the opportunity to have was to go on a series of home visits with some of the community nurses in St. Mary's, where they provide in-home care, and I can see how much it means to people to be able to stay in their homes even when they don't necessarily still possess all the abilities, physical abilities to care for themselves. And so I think that absolutely we see better results. We see better, we see happier people, and we see it just makes sense to enable individuals to continue to live in their homes and provide them with just a little bit of the assistance they need in order to care for themselves or to continue to maintain their care. So I think that's absolutely the direction we need to look at going, is making sure that we are administering these services in the best, most efficient way possible, and that we are doing it in a way that gets results.
Mr. Straw, would you like another minute to comment on the issue?
I just have one question for my opponent. If he thinks that home and community-based services are so important, I'd like to ask him why he voted last year for the Severe Amendment, which cut 27% from the budget for home and community-based services.
Mr. Gabler, you have 1 minute.
I think it is important that in our state budgeting that we make sure that we do what we can afford. We do what is actually there. Without putting budgets into place, what we've done is we've put ourselves into a position where actually what ended up happening was the budget that passed was based on faulty numbers. The budget that passed ended up putting it in a position where the governor unilaterally made cuts to these services across the board, to services in any departments, and there was no public vetting of that because the budget that was passed did not actually allocate money that we had. It spent money we did not have. So I supported a fiscally responsible budget, as I pledged to the taxpayers that I would. It was a plan that was available, and I think that it is important as we go forward that we continue to make sure that we are not passing debt and problems onto our kids and grandkids by doing irresponsible budgeting.